we are excited to feature Habeebah Rasheed Grimes, CEO of Positive Education Program. Serving our community's most vulnerable children has been Habeebah's life's work. She first joined PEP in 1999 as a one-on-one aide. After earning her master's in clinical psychology and a specialization in school psychology from Cleveland State University, Habeebah returned to PEP as a clinical supervisor for one of its day treatment centers. After being promoted to the chief clinical officer role in 2015, she led the organization's embrace and ultimate certification in evidence-based trauma-informed practices, working closely with the Child Trauma Academy. In 2018, she became the organization's chief executive officer. And she is known as someone who is very comfortable creating brave spaces and having courageous conversations. Habeebah is a graduate of the Robert Wood Johnson Foundation's Ladder to Leadership, Developing the Next Generation of Community Health Leaders program. And she has been honored by Crain's Cleveland Business as both a 40 under 40 and a woman of note. And she is being honored tomorrow night by the Urban League of Greater Cleveland with their Education Champion Award. She serves as a mentor for multiple organizations and collaborative ventures, including the co-chair of Say Yes to Cleveland Integrated Health Task Force, an advisor for Empowering Youth Exploring Justice, vice chair of the Mental Health and Addiction Advocacy Coalition, Northeast Steering Committee, and is a member of the Cuyahoga County Citizens Advisory Council on Equity. She is also a member of the Leadership Cleveland class of 2020, and we are so happy to have her join us today. Please welcome Habeebah.
Thank you, Rachel, for that introduction. Thank you to the Cleveland Leadership Center for this opportunity to speak with you all today. Thank you for being present. I know that your days are busy and I see several PEP champions and friends on the call. I see my Leadership Cleveland 2020 colleagues and cohort members and friends on the call. So shout out to the best class ever and longest class ever. We took our class trip to Pittsburgh a couple of weeks ago, and it was so wonderful to be together. I am honored to talk with you today about PEP, which I've served for 20 years, and the young people that we care about are young people who are very near and dear to my heart. I often say to folks that my leadership and my service come from the intersection of lived and professional experience, and PEP's been a beautiful place for me to live out that leadership and service. So I have a few slides that I am going to share with you to just help navigate these comments that I'm going to make over the next 12 minutes or so that we have some time to be together and I can answer any questions you might have. I'll start with just my intentions for my conversation and sharing today, which is to honor PEP's history and share how we're leading for the future. PEP is a 52-year-old organization now, and we have a tremendous legacy that we hold as we navigate toward the future. And I want you to see this image that came out of some strategic planning work that we did in 2022, because it really does highlight who we have been in the community and who we are today. So PEP is short for Positive Education Program, and we're a youth-serving nonprofit that predominantly serves Northeast Ohio across a continuum of services that include early childhood mental health services and consultation services, school-based and system-based training and consultation, direct service in the space of intensive and moderate care coordination through PEP Connections, which is an Ohio RISE care management entity, or CME, and through our day treatment centers, which are facilities that function as schools for young people who have significant needs, either developmental or mental health, as in terms of the origin of those needs. And many of those young people have endured a great deal of trauma. Our founding in 1971 was out of a call from local school districts seeking to respond to a public law that required that young people be educated with their same age peers who were accessing the general educational curriculum pretty readily. These young people with disabilities have barriers and impediments to accessing the general curriculum. And so our founders started out providing consultation and training in response to that call for assistance to really ensure that young people's educational rights were protected and preserved and responded to. That special education work that we were supporting in our school district partners grew into our day treatment centers, and PEP being the provider of those special education services. And over the years, PEP has continued to respond to the call of the community that was responding to the needs of the young people that they serve. And in doing so, we built out our early childhood capacity, our services in the autism space, really refining and targeting those services in a very unique way, an eclectic way in service to young people whose developmental needs and autism diagnosis are profoundly interfering with their ability to access curriculum, build relationships, and so on. And then the community-based care coordination, often called case management space, really responding again to the need of young people who are multi-system involved, meaning they are at risk for or already pretty deeply involved with systems like our Department of Children and Family Services, which is often called our child welfare or child protective services system, our juvenile justice system, the Department of Developmental Disabilities, even our hospital systems. So helping young people navigate life, including their educational life, but also their community and family life as smoothly as possible. It's been our work, in particular and specifically for those young people whose needs are most profound. In 2022, after just over 50 years in existence, we revisited our strategic plan and went through a process that helped us to bring a new mission, vision, and set of values forward. And you see those here, with our intention being of supporting young people to overcome and thrive, given all that we've learned in the course of our history around the importance of young people living in a community that is supporting their needs, lifting up their skills, their strengths, their abilities, and doing so in ways that really center joy, really ensure an integrity of intent, but also in action, aspirational hopes that are often denied to young people with disabilities or with special learning needs or mental health challenges, developmental needs, and doing that with courage and heart meaning something bigger than care, bigger than concern and compassion, but something action-oriented, something that is deep within the soul and spirit and work of the organization to help our young people. We also grounded all of our intentions in the notion of anti-racism, along with our kind of core philosophy of re-education. And I'll talk a little bit more about why that was so in just a moment. But that all has been really driven by our understanding of PEP as a trauma-informed organization long before folks were using the term trauma-informed. This notion of re-education, this philosophy from a gentleman by the name of Dr. Nicholas Long that described young people as capable, believed in young people even when they struggled, as able to learn, be in community with one another, experience joy, that word joy again, their ability to practice self-control and engage in higher order thinking. That confidence that Dr. Nicholas Long had in young people in the 60s was not the zeitgeist of that day. And PEP's founding and orienting to those essential beliefs about young people is our core philosophy. But we've also invested over the years in trauma-informed frameworks and models of care that help us understand the science that Dr. Long so intuitively know in an evidence-based world. And so we've leveraged that knowing and grounded our work in the ways that we have to support the well-being of young people who are not only impacted by individual experiences of trauma, familial experiences of trauma, or even community experiences of trauma, which are so often centered when we're talking about trauma-informed care, but we're also talking about systemic and structural sources of harm, sources of trauma, the reality that racism, poverty, create and sustain the conditions for suffering that children experience and require our response as a community, as individuals, and as an organization. So in service to all of that, these next few years, we are working to optimize our programs and services coming out of the pandemic and taking those learnings. I almost hesitate to say come out of the pandemic. We are still very much impacted by the challenges that the pandemic created, the magnification of challenges that youth and families experienced because of the pandemic. And so we want to be creating our programs and services in recognition of those realities, and also understanding that the pandemic did not create these realities, simply exacerbated challenges that were already existing. We want to tap into the creative spirit that caused PEP to be, and so we want to be innovating over the next few years and working to establish a flourishing workplace, which again, I'll talk more about shortly. Our overall goal in our strategic framework is to be an organization that is adaptive, that is more like a living system than a factory where machines are working and gears are turning and widgets are being made. We want to operate more like an ecosystem where there is life, where there is a mindset of abundance, and there is an acknowledgement that as resources shift, as vulnerabilities might be identified, the ecosystem adapts to those realities. And so that is our goal to uphold these three priorities over the next few years. In service to these priorities, we are setting ourselves with a mindset that we are, yes, legacy keepers as members of this organization. Those who've engaged with PEP, you surely know there are folks at PEP who have long histories of working in the organization, like me, someone with a nearly 20-year history at PEP. But we also want to be using that legacy to be responsive to today's times. And so I thought these things might be of interest to you as leaders in the community in consideration of what we're looking to do as an organization. So first here, I wanted to just shout out the Cleveland Leadership Center for giving us this opportunity to be present with you, because it aligns with our intentions to advance and share our mission more broadly. There are some folks who will say to me and have said to others in my time at PEP, gosh, I didn't know this organization existed. I had no idea there were people doing this kind of work in our community. How interesting. And with a history like ours, you would hope that more people know about our work. And we've been so busy with our heads down in the work, partnering with our school district partners and our local Adams board, our system partners, to just meet the needs of the young people we serve and the complexity of those needs, that we haven't always lifted our heads up, put a megaphone to our lips and shouted, we are here doing necessary work in our community. Support us in this work, join us in this work, know who our children are, celebrate them, champion them, be present for them. And so we want to do that more and more vocally. We are blessed with a wonderful board of directors, champions for kids like ours. We have an amazing staff, and we have amazing young people. And so together, we're going to make sure you all know about PEP and you know about our mission and our work, and help us know when needed who the children are who might need us. We are also working toward creating conditions for our workforce to flourish, and that involves some advocacy as well as some internal work on our part. We sit at the intersection of education and mental health, and if you haven't heard, you need to know that the workforce that serves young people in schools or young people in a hospital environment, psychiatric environment, community mental health environment, those individuals have really struggled over the last few years. Their response to the pandemic was amazing. Teachers worked hard, our mental health practitioners and colleagues worked hard, and that intensity of work didn't subside when the worst of the pandemic subsided. It's just persisted, and frankly, it's intensified. And so there are some folks who were who chose education and mental health as their life's work, who have decided that is not something I can sustain. And so we've seen a lot of turnover, and we worked hard to recruit folks to these spaces in the education, specifically special education space, the mental health space, community mental health, most specifically, not office space. We want to be in the community, in the homes, in the lives of the children we serve. It's difficult work to conceive of. Part of the challenge is salary. The rates that mental health providers draw down, particularly from Medicaid, frankly, are not meeting the increased salary demands that these workers should have always been able to ask for, right? The other realities of school funding and the challenges that schools are experiencing as they exist in our current funding environment for public education has long been a challenge, and that challenge has been intensified by the pandemic. And what can be demanded of salary for teachers has also escalated exponentially, and everyone's competing for this workforce. And as the need continues, we are finding it challenging to keep pace with all of that. And frankly, the situation is just unsustainable for our entire community. And so we have to work to ensure that teaching, working with young people in mental health settings, that is sustainable work for folks, that they can take care of families, that they feel like they can thrive. And organizations need the resources to create conditions for them to thrive and to flourish. So that's work that we are focusing on. We are also going to continue to be courageous in our commitment to equity and justice. This is something that we do internally as an organization, and we do it externally. We know that disparities in outcomes in education and social and mental health outcomes for young people are poorer when those young people are Black and brown, and we can't stand for it. We won't stand for that. We will use our voice to lift up the disparities, what causes those disparities, the structural and systemic factors. We're going to hold ourselves accountable in that regard, and we're going to ask others to be accountable in that regard. And we don't think diversity, equity, inclusion, and belonging are optional. They are essential aspects of leading, essential aspects of serving. When you add in disability to that identity picture for young people, when you add in or consider gender identity, sexual identity, and so on, the risk factors just grow. And so we want to be part of ensuring that young people are not experiencing these disparities and frankly, the violence that they are exposed to inside of systems and inside of our culture. And then lastly, we want to be part of the response to the youth mental health crisis that you've surely heard so much about. We are looking at our continuum of services to ensure that we're the best partners we can be in responding to this youth mental health crisis for our community. And we also want to make sure folks know what we know about trauma-informed practice and how you can serve young people in ways that leverage the skills and abilities of anybody who wants to have a positive relationship with the young people. In that sense, we are all teacher counselors, and that's what we say at PEP. We're all capable of meeting young people where they're at and being a resource to them and a buffer to them in these most essential times. So I will stop there. And I hope you have some questions for me.
Habeebah, thank you. And yes, we do have a few questions. So let's start. You've mentioned the trauma-informed care model. Can you share a little bit about what services look like within that type of model?
Yes, absolutely. So I want to start with, what does an organization look like in a trauma-informed care model? Trauma-informed care at PEP is not just about what we do with or for young people. Trauma-informed care is about who we are as an organization. So PEP has adopted the commitments of Sanctuary, the tools of Sanctuary, which is a national model for trauma-informed practice, and it focuses on organizational change. And organizations have to start with that change model because, quite frankly, historically, institutions intended to help people have been a source of trauma for people. Also, individuals who come into an environment and experience trauma, we're human beings, we have mirror neurons, we are designed to take in someone else's experiences and resonate with them and then reflect back to them what we're experiencing. That can result in vicarious trauma. That can result in burnout and compassion fatigue. And so we want to acknowledge that as folks walking alongside people who've endured trauma, we as individuals and as an organization experience trauma too. You add in some of the policy implications, funding realities, and the organization is enduring a lot. So we acknowledge that first. Secondarily, we've put in place a program or a model, a framework, I should say, of working with young people in a neurologically responsive way, a developmentally responsive way, and a biologically responsive way. And what that means is we've adopted a framework called the neurosequential model. It's complex sounding, but rather simple. And the basics of it are that our intervention with young people need to involve regulating their nervous system and helping them create a level of self-regulation for themselves, doing that in partnership with them and presence with them. And that's things as simple as walking or drawing or riding a bike or dribbling a basketball, those things that regulate the nervous system. We also work to after that sense of regulation is achieved, to build relationships with kids so that they are able to build that trust and partnership with us in their healing journey. And then we try to teach some of those psychoeducational skills and abilities that are harder to do when someone's dysregulated or not in relationship with us.
You made mention of the impact of the pandemic and the ongoing impact. What are you seeing among the youth that you serve?
So I'll start here actually with the adults. What's happened to adults over the last few years has been greatly dysregulating to our nervous systems. And so our ability to manage the stress that we feel, model for young people that stress management, have some sense of capability and resilience in the face of all that happened has been greatly compromised. So I've never witnessed the level of distress among my colleagues that we've experienced over the last several years. You add to that the organizational stress that the pandemic created, and you feel a heaviness among the people who are serving our young people. Our staff have rallied, they've worked hard to show up every day and be what our young people need. And when they encounter the young people, they have been more distressed. And so for our young people and those who, really anyone under stress, when your nervous system is dysregulated, you have less ability for that higher portion of your brain. Sometimes we call it the neocortex. We call those skills executive functions. Those are the things that keep us regulated so we can sit in a meeting or a learning space and actually take in what's being taught, even if we have to use the bathroom, or even if we're hungry, or even if we had a conflict or a fight with our spouse, right? The nervous system can be self-regulated through those higher functions in the brain. But for our young people, that nervous system regulation has been greatly compromised. Just the disruption, the movement into the home space and having to learn virtually, the stress and strain of that. So many of our young people didn't have the resources that they need, and they didn't have the caregiving support that they might have needed as parents and caregivers were trying to figure everything out with work and so on. And so coming back into our environments, there's a higher level of stress and activation that we see that can result in some acting out behavior. And what we know in our work about how stress shows up through acting out behavior, we know that our district partners have been seeing some of that same need in the school districts. And the other thing is safety. Our kids are not feeling safe in the world. The level of gun violence touches our kids as it does others in our community. The level of grief that is incurred by multiple losses resulting from gun violence on top of losses that our young people experienced as a result of caregivers and others who succumbed to COVID-19. And so you have a tremendous amount of grief that kids are trying to process alongside the stress. And so the work that we try hard to do is ensure our caregivers, our staff are as regulated as they can be so that they can support parents and caregivers to be as regulated as they can be so that we all together can co-regulate our young people. And it's a heavy lift right now.
As you look ahead down the road, say 5 years from now, what is the vision that you have for the PEP organization?
My desire for PEP is that we would be sustainable, that we would have a series of or a continuum of services that are adequately funded by our systems and by our funders, that the programs like Ohio Rise that today are working to ensure that young people have their needs met, that those programs and services have stabilized and that are delivering on their commitment to help young people thrive in our community, that PEP would be an environment that is a model for others who want to do trauma-informed care work and in a way that is culturally responsive, in a way that is neurodevelopmentally informed and innovative and creative. So those would be kind of my primary hopes for our organization. And in 5 years, I sure hope we have a national voice. That feels so important that Northeast Ohio, and then all of our country learn from what we've been doing and that we become collaborators and partners for those who are seeking to do similar work or want to continue to learn how best to meet young people's needs.
What challenges do you anticipate being in the way to reaching that vision? And how can those of us on today's call help you overcome those?
Yeah, thank you for asking that. So I spoke about financial sustainability first, right? No margin, no mission. And there are some things happening right now in the legislature around public school funding that I would hope you would pay attention to, because schools are an essential village for young people, and our most vulnerable young people are counting on public schools to really work miracles in many instances. And our public school partners show up trying to do that. You look at what's been accomplished in CMSD, for example. And so our public schools need our voice right now to ensure that the community understands how essential they are to the well-being of our community. And there's activity happening in the legislature that I invite you to take a look at and consider advocating around. Young people like ours are not contemplated in things like voucher systems. And so those can be they can create a lot of vulnerability for young people like those we serve at PEP. Also, the Medicaid funding situation in Ohio, our rates did not change for over 2 decades in the Medicaid system. And in 2018, there were some changes, and then the pandemic happened. And so we need our state to really look at those rates and consider some enhancements. And there's some advocacy happening right now that invites us to consider even a 20% rate increase on those Medicaid rates. That's the only way we can offer sustainable salaries to our workforce. And it's the only way addressing rates is one of the ways, I'll say, because professional quality of life is a whole other conversation. But salary is like the fundamental baseline to inviting people into an industry. I say that on behalf of our colleagues in mental health, and I say that on behalf of our teachers and special education teachers. It's essential that we address these funding challenges. And there's work happening right now that I invite you to take a look at and maybe add your voice to and help us raise awareness and create change.
When you look at the work that you do and the work of your organization, what brings you joy from that work?
It's the young people. Like, that first and foremost for me is them. I see myself in the young people I serve, and I have since I stepped foot into a PEP Day treatment center. I see my friends from my childhood and my siblings. I see all of us in them, and watching them see themselves through a new lens of possibility, their potential, their giftedness, their brilliance. These young people need help to bring that forward. They need some folks to know that their suffering was not their own fault, that their suffering is oftentimes not the fault of their parents and caregivers. We're talking about generational trauma here in so many cases. We're talking about young people who exist in an ableist world that doesn't have the will sometimes to see their brilliance, even if they can't use words. And so watching them shine and the way that our staff helps make that happen is an absolute joy for me to this day.
Well, Habeebah, thank you for sharing your important work today, and thank you for all that you and your team do to help the youth in our community tackle some of these very big challenges they see day in and day out.
Thank you all again for the opportunity. Thank you to the attendees today. I'm so honored that you would take time to listen. Thank you.